Welcome back to my YouTube channel, and today in this video we were talking about bunions. And as always, we're going to go over what a bunion is, what are some simple things you could do at home to help treat it, and as always, when it's time to call your doctor. So let's get started with this video. So what is a bunion? Many people think bunions are growths or bumps that occur on the side of their foot, when they kind of are, but actually what it is a dislocation of the big toe joint. So you're starting to see the bump form as that great toe joint starts to dislocate. And when that happens, the toe starts to migrate over towards the second toe. When this happens, you'll start to get a callus in between the first toe and the second toe. It can occur on the second toe or on the big toe itself. And over time, sometimes this deformity becomes so severe that the big toe will cross over the second toe, or the second toe will cross over the big toe. So throughout the process, early on, it kind of starts as a small bump forming on the side of the foot, and then over time the bump becomes larger. And as this occurs, you will start to get erosion or degradation of the articular surface or the cartilage that's inside the joint. And as this happens, it starts to become painful. So why do we get bunions? Some people think they're hereditary, and they certainly can be. So you can be born with the bunion, or you can be born with a predisposition for that bunion to come out later in life. My daughter actually has a bunion, and she's 13, and she was born with this, and I've watched it gradually get worse over the years. And she's only 13, and it's getting worse and worse as each year goes by. Some people think that shoe gear causes bunion deformities. While that's true, it's not the only cause. As I've demonstrated, children can be born with these, and over time they get worse. So I think what's important to know is shoes can make the condition worse, but they're not solely the cause of it. Don't blame yourself at this point if you're in your mid-40s or 50s and you say, well, I have a bunion deformity, it's my fault because I wore high heels growing up, or my parents put me in certain shoes as I was a kid. It's not their fault. You probably had that predisposition or that genetic makeup to have a bunion occur, and maybe the shoes somewhat aggravated it as you became older. So while high heels can be a cause or a factor contributing to pain from their bunion, they're not the sole cause of bunion deformities. What are some things you can do at home to treat your bunion? Well, to start with, wider shoes is probably the best option, because when we wear a wider shoe, it takes some of that pressure off the bump that's forming and kind of lets the toes breathe, and it's not squishing them together, making it feel worse. Another option are toe spacers. If you can put a spacer between the big toe and the second toe, it'll kind of push that big toe over and realign the articular cartilage or the joint surfaces. You may have also been Googling or looking online and find bunion splints. Bunion splints will work, but what you have to remember is as soon as you remove that bunion splint, the big toe is going to pop back over into that bad position that it was in. There's another product out there that's probably one of my favorites. It's called Correct Toes, and it was created by a friend of mine, a colleague that's in Seattle, Washington. And Correct Toes is something that you wear, and it fits in between all of your toes, so it helps to splay your toes and putting them in a natural position. So your toes are kind of like this, as opposed to being squished together in your socks. These are very similar to what some people call yoga toes, or for you women out there that are getting pedicures done and they put those foam spacers in between your toes. It's very similar to that, except you wear them in your shoes and in your socks. So it's not something that you sleep in and hope that it puts the bunion back into position. It's something that you're functioning in and wearing so that your foot, and especially your toe, your big toe that is, can function in a normal anatomic position. What about orthotics? Many people think orthotics can help prevent your bunion, or they'll come into my office asking, I was given orthotics to help stop my bunion from getting worse. Orthotics can help, but really they typically make it worse. The theory is that they'll stop that excessive motion to your arch, or what we refer to as increased pronation. And we think that increased pronation or collapsing of the arch can aggravate or accentuate the deformity from happening. While this is true, what I've seen happen clinically in practice over the years is when we put that orthotic into a shoe, it makes for a tighter fit and actually aggravates the bunion. Some other simple answers are icing your foot at home in the evenings, or taking anti-inflammatory medications if your medical health will permit or your doctor allows you to take an anti-inflammatory. So, most important part of the video, when should you call your doctor for a bunion deformity? Well, what I tell my patients when they come to the office is, if it doesn't hurt, we don't fix it. Kind of like that, if it's not broke, don't fix it mentality. But with that said, the longer you live with a deformity, the harder it is for me to correct, or any surgeon to correct, because the more deformed it becomes, we can always put it back into position, but sometimes you're putting a joint back together that has that eroded cartilage that we talked about earlier. So if you wait too long to fix your bunion, when you put the joint surfaces back together, there's going to be bone rubbing on bone, and you might have the bump removed, but that motion is going to become painful. So when is it time to fix it? I usually use pain as an indicator. So when you're starting to get pain or grinding or swelling, or you notice that redness on the inside part of your bunion deformity or inside part of your toe, it's time to start thinking about fixing it. And I usually give my patients that general rule of when the time suits you, or when it's best time for you over the next year, that's when it's time to have surgery. For some people that's in the summer, some people it's in the winter. Teachers like to do it in the summer because they're off. Other patients like to do it according to seasons. It might be easier for them to do it in the summer because they can get around better. For those that live in colder climates, they don't want to do it in the winter when it's cold. Those are some of the things that you want to think about. Some other things to think about is, if it's your right foot, that's going to affect driving. And you won't be able to drive after surgery, because if you had your right foot operated on, you're not going to be able to operate the pedals in your car. So to wrap it up, remember, it's a deformity that occurs. It's not a bump. It's a dislocation of the joint. Wearing wider shoes, toe spacers, things like that can help you at home. And when it becomes painful, it's time to call your doctor. And many of you out there would like to see how we actually fix a bunion surgically. That's not the intention of these videos. These are usually educational videos, because some of my audience doesn't like to see the graphic or the bad pictures and video that we do during surgery. But you can click on some of the links in this video that you're seeing now to see what it's like and how we fix bunion deformities. And you can also look in the description below, and there will be links to some surgical videos that I post on this channel as well. So thanks for watching my video about bunions. Make sure to hit the subscribe button to see more upcoming videos that I'll be posting in the future. And if you have any questions or comments or thoughts about conditions that you'd like to hear me speak about or talk about, make sure to put them in the comments section below. Stay tuned for our next video.